Lionel Richie gets us into the medical hour here on a Wednesday, all brought to you by the community health professionals and the medical specialty clinics at the Bryan Hospital. And today, I'm lucky enough to have the Williams County Health Commissioner with me today. I've got the boss. I've got Jim Watkins with me here today. And Jim, welcome on in today.
Oh, thank you. Thank you. Glad to be here.
It's good to have you in, and it's good to have you part of what we're in the process of doing here today, which is talking just a little bit about health and wellness and all the good stuff that's going on around Northwest Ohio. And the neat thing I think about what we're doing today is you guys are 100 years old. Not you personally.
Thank goodness, huh? I'm in great shape for 100.
Yeah, you know what? For our real age, Jim, we're probably not doing all that well. But if you think we're either one of us 100, man, we're spectacular right now. How's that, huh?
Yep.
But it's good to have you in, and it's hard to imagine that the health department in Williams County now has hit the century mark here in 2019. How'd this all get started? Why did we start a health department?
Well, basically, health departments were here in the county over 100 years ago. But what happened 100 years ago was that we had the great Spanish influenza that killed thousands of people across the country. And Williams County was not immune to that. So what we know is that here within the county, there were different approaches on how to handle that. So we had health boards in Montpelier, health boards in Bryan. Some of the townships had them. Some of the other villages did. And so what had happened is that across the state of Ohio, there were different rules that were put in place by health boards, and they were very inconsistent. And as a result of that, they felt they had not contained the Spanish influenza here within the state of Ohio well, and caused needlessly, perhaps, some deaths to occur. So the state came up with a law that they passed actually in 1918, and they required that all these health boards were consolidated into a single county health board. And so we have the Williams County Health Board that first met in January 1919.
Wow, that's truly amazing. The Spanish influenza, when did that start then? When did that all outbreak start?
Well, it started in 1918, and what happened is that with World War I was going on at that time, and so we had a lot of individuals, a lot of young men that were in camps across the country where they were all together. And as a result of that, bringing people together, influenza can spread very rapidly, and so it did. And this was a particular influenza that had not been seen before, virus that ended up that people would perhaps have a mild case, or they could go very rapidly. So we had young folks, and that was what was very shocking to people, was that people that were in the prime of their life, and they would suddenly, within 24 hours of seeming to just only have a mild case of influenza, die.
Wow. Now, this wasn't just a Williams County event. Was this not worldwide?
Worldwide, yes. This was a pandemic, and what we mean by pandemic is that throughout the entire globe, we were seeing this influenza, that was going around. And in fact, historically, why it's called Spanish influenza is the fact that it was reported very well out of Spain. They actually believe that it didn't start there, but World War I was going on. The Germans and the Allies didn't want to report that they had this illness going through, because that might mean that, hey, maybe we ought to attack. Yeah. So as a result of that, there was some suppression of the reporting of this, but Spain was not in the war, so as a result of that, that's why we call it the Spanish influenza.
I'll be darned. That is amazing. And you can see how tactically, if you're a general or a commander of some sort, you don't want the opposition to know that your guys are a little puny here today. Mm-hmm. So you're going to cover that up and not say anything about it, and toughen it out, and here, take these. And well, how did they treat that flu in that time in 1919?
Well, they really didn't understand it well at that time. Bacteria was known at that time. They knew of the existence of the fact that we had bacteria. They did not know that viruses existed at that point. They did not have microscopes powerful enough to be able to see a virus, so they didn't know that even existed. So they treated it as a bacterial disease because that was the extent of the science at that time. So that's what they tried to accomplish it with.
Wow. And so what would a normal, if I went to the doctor, what would the normal prescription be? Go home, to get off your feet, to drink a lot of warm broth and a lot of water and tough it out? Is that basically how we treated it?
I can't say that I can answer that. I'm not sure exactly what was done. There was still a lot of debate. Even one of the things that they were doing is that they were instituting quarantine, trying to separate people.
Okay.
So here within the county, we know that they closed the moving picture shows. The Bryan Board of Health, I know, had a 2-week, you could not go to church, you couldn't go to the moving picture shows. They did not want people congregating together. We know now that is an effective measure to utilize, but some of the things that we also know is that there was still debate. There were some physicians that didn't believe that was necessary. So there was a lot of inconsistency even in that concept of whether to do it, whether not to do it. And within our county here, we know that we saw differences in how it was approached. Some communities said keep everything open. Others took the advice from the State Board of Health at that time that it's widespread and we need these places closed so that we don't spread it person to person, which is something we still look at today, is that if we tell people that if you're sick, stay home. Yeah. We don't need you to come to work and get everyone else ill, and it is an effective measure to try and stop the spread of the disease.
Oh, that's amazing. You have brought with you today some documents that are 100 years old, roughly, okay? Mm-hmm. And I'm sure you have records from the health department now being 100 years old that you can go back through and trace your history. But some of the ones that we were talking about before we got started today, I found the stories intriguing. I mean, you told me a story about a wife of a soldier who had to make a trip down to see her husband. You tell the story better than I do, so let you share it with the folks that are listening right now.
Sure. One of the things that we know that was reported in the Bryan Press in March 1919 was of a individual that she and her brother-in-law traveled to a Fort Murray in Kentucky to visit her husband, who had become ill with the influenza. And so they got on a train, I'm not sure where, here in the county, and they traveled on down to Kentucky. When they got there, her husband was still ill, but at that point then, the influenza was running rampant in the camp. And lo and behold, this individual, she became ill. So she traveled back on the train on the advice of the physician. As I said, they didn't understand things as we do today. So they had an individual. She clearly had influenza. They had determined that, and they put her back on a train, which I can only imagine was probably a 2-day trip at that time to get back here, exposing everyone else that possibly could have been on the train. They got back here, and in that time, she lost all 3 of her children, became ill then. And the last little boy died within 24 hours of his second sister to die. And so it hit the young particularly rapidly. And her brother-in-law, sister-in-law also became ill. She actually ended up passing away also. So it devastated families at that time. So it's I can't imagine what that must have been like here in the county to hear such rapid loss in families. But that's what was going on.
Yeah, and all while you have a world war going on at the same time.
Correct.
So that's also tragedy coming back to the area.
Yes. Because
of loss of life in a battle somewhere.
Sure.
You never would have thought, I'm sure, in that day that you were going to lose your loved one to the flu. Mm-hmm. Now, to lose your loved one in the war,
sure,
that was definitely happening. But
right.
then to lose a wife and 3 children while he was ill, serving
right.
his country.
Right.
What a story.
Yeah. And he actually recovered.
Okay. So he survived everything.
Correct. Survived
the war and lost his entire family.
Yes.
Wow. That's amazing.
Yes. So it's a very personal story. I mean, what we look at a lot of times is we're looking at numbers and statistics and things of that nature. So it's quite interesting to see the story behind that. I think that these were real people. These were people in our community that experienced that.
Yeah, that is amazing. And the Spanish flu. Has there been as devastating of a flu since that time, 100 years ago?
No, that one in particular really stands out.
Yeah, that is the worst of all time. In a time when it was maybe the worst of all time.
Sure,
period, all the way across the world at that moment.
Right.
Wow.
Right.
I bet you if you went down to your archives and you started pulling out the documents like that. A guy could sit and read for days and days and days the history of Williams County from a health perspective, couldn't they?
Sure. Yeah. As you start to go through it, you really start to see the evolution of the health department over time. I mean, what we see in the 1920s and into the 1930s, the health commissioner, who was full-time physician for the county as the health commissioner, was going around and actually following up on where they were hearing that people were coming down with illnesses. So they were doing that. They did a lot of quarantine. That was the method that they used at that time to try and stop the spread. So that was a very common practice that they did. So we see them doing that. We also see then in the 30s that they start to address some of the other issues that are happening. We know that they started to work with the communities on regulations in regards to such things as some of the things we've run across. If there were dead animals, livestock, that you couldn't let them lay in the streets of Bryan, which is pretty amazing, but that was the way it was. And so you start to see the investigation early on to where they actually had to go out. And then we start to see, with the advent of the telephone being more common, that they started to actually get reports directly to them, with the modern technology of the telephone.
That's something that I didn't even think about, because in 1919, who was the first health commissioner in Williams County?
It was a Dr. Wheats,
okay.
Was the first health commissioner in Williams County.
And at that point in time, there were no telephones around our area. It was relatively word of mouth. I would think we're probably still talking a lot of mud streets in a lot of areas around the area, too.
Yeah, they would have probably a lot of information, I'm sure, was coming into them word of mouth of where they had heard that so-and-so had some illness or whatever. And you got to remember, you're going back to the days of the house call.
Yeah.
So a lot of it would have been just discovered in those ways. You didn't hitch up the horse, or by that time, obviously, they would have had automobiles, a good portion of the population. But you look at that, and that to take a journey like I did down here today of 10 miles would have taken a little while to get here.
It really would have. It's amazing. Jim Watkins is our guest today. He's the Williams County Health Commissioner. The health department is 100 years young now in Williams County. And we've got Jim with us for the entire hour today. Some great stories we're going to talk about. And we're going to progress our way into where they are today and some of the challenges and the stories that they have going on right now as well. We're in the middle of our health hour today, all brought to you by the Medical Specialty Clinics of the Bryan Hospital and the Community Health Professionals.
Coast Ohio's largest
came in throughout the state of Ohio and across the country, and the health department really led the way on that. We still do vaccines today. We still do immunizations. We have flu clinics, things of that nature. So we're still involved in those types of things as far as that goes. One of the things that has happened over time is obviously we talked about the telephone and how that made some changes on how they discovered illnesses within the community. Today, we have a very modern system that with the advent of computers, we get real time on certain types of health issues that are occurring, not only within Williams County, but throughout the state of Ohio and actually nationally, and some idea of what's going on across the world so that we can kind of keep up on these things. Because we know that the more lead time on anything, we're better off to be able to have a proper response. So we work with a lot of partners on that. We work with community hospitals of Williams County very, very directly when it comes to those types of things. We work with Parkview physicians very closely on those types of things. So it's a collaborative effort in regards to working to try and combat illnesses as far as that goes. As time has gone along, we are now moving into some different partnerships for us that have occurred over the last several years that we probably had at one time, but they certainly are much stronger. We work with our local 911 office when it comes to being able to respond to things. They're our backup when things happen after hours. So, you know, you might think of the health department open from this time to that time, but the 911 office here in Williams County has really done a great job of being a partner, as well as working with our local EMA. That is something with emergency preparedness. When we think of a few years back, we had the H1N1 that was coming around. We worked very strongly with the EMA on trying to make sure that those things are handled properly and in the county. And we're very fortunate to have a very strong EMA 911 here. We have great leadership of that is very valuable partner for us here in the community. We work with, like I said, with the hospital and the physicians groups, mental health we work with now to try and address some of these issues, such as when we think of some of the substance abuse issues. We know that mental health can be a part of that, trying to give people alternatives to these types of things. So I would say that where we are at today, partnerships is a big piece of what we do. We really, really work with those types of partnerships, not only here in Williams County, but we do a lot of collaboration with our other local health departments in the area as far as that goes, to try and see how can we work together smarter, pool resources. That's, you know, the key to anything these days. So we try to do a lot more of those types of things. So,
well, you know, we started in a day where coming from Montpelier to Bryan might take you half the day to get here, all right, to a point now where getting anywhere around the area in an hour can get you to Toledo, to Fort Wayne. So now somebody who has whatever issue that might be in that same hour can be 60, 70 miles farther than what he was back 100 years ago. So it's probably critical to have those relationships.
It is, and you know, technology has its good and bad. You know, sometimes it's a little overwhelming, all the information that we take in, and we try to manage that information as best we can that flows into us. But I think that the important parts that we really are trying to strive to is trying to get some of the social determinants of health. That's been a focus that we've been trying to work on over the last several years, in that we know that there are certain things that if we can work on those to try and have people have better living conditions, things of that nature, then that works out that they will potentially make better life choices on health issues. And so trying to get further down the line rather than trying to just address it once we know that a disease is coming in to the community or whatever.
Yeah. How many different employees work with you nowadays? How many folks involved in the health department of Waynes County?
We have approximately 21 staff. So those staff have varying types of jobs. We have our Women's Infant Children program, which also known as WIC, that works with young children to get them off to the right start, to make sure they have the proper nutrition and get the parents get nutritional education as a part of that to help hopefully make correct choices dietarily. We also have our environmental division. Environmental is the folks that when you go out to eat, they are the ones that make sure that the restaurants are following the state codes to ensure that we have safe food. They address those types of things. They also, when it comes to water, they are the regulator of private water systems, septic systems, things of those types of things. So they're kind of a regulatory entity of the health department. When it comes to vital statistics, birth and death certificates are all recorded with the health department. So we have staff that assist individuals with those types of things so that they can get their birth certificate, to get whatever type of government documentation they might need, and also to assist with getting death certificates taken care of with the funeral homes within the county as far as that goes. Nursing division, we have immunizations. As I've repeated many times, communicable disease is a major factor of that division. Following up on that, so like influenza is something that we still track today. We still try to keep on top of. We also will investigate illness outbreaks, so like norovirus, like you see on the cruise ships that happen. We have that occur here. So we work with different entities should we have an outbreak of that to ensure that they properly handle that so that we don't have it spreading in the community as far as that goes. Our community health education division has our emergency preparedness, or I guess I'm using the old term, our health education and preparedness division.
Okay.
Our health education preparedness division is responsible for ensuring that we have a community health assessment every 3 years and a community health improvement plan. And we're very proud of that. That's one of those things that we've worked with our partners over the years, and we have seen improvements in the health of the community. Again, everybody has their part, but we're just kind of all collaborating on the same issues as far as that goes. Emergency preparedness would be under that, and that's where we work with the EMA very strongly to ensure that all the partners within the community are prepared for a response that could be health related. I think one of the other things that we're very, very proud of, in 2018, the fall of 2018, we received national accreditation as a health department. We are one of the first 20 so health departments within the state of Ohio to become nationally accredited. It's taken us many, many years to get there. It's a great honor that we've been able to achieve and has helped us improve as a health department to better interact with the community. I think is one of the big pieces I see with that. Getting the community involved in our decisions is what's important. I think as far as trying to make improvement, the community needs to be a part of that. And accreditation pushes us in that direction to make sure that every time that we do something, the community has a voice and has a say in what we're going to do. So lot of change, a lot of what we were doing in 1919, yeah, we're still doing that.
Yeah.
So that hasn't changed. But a lot of really evolution of the health department. We try to be always looking forward. We're much more sophisticated than we would have been at that time, and we hope to continue down that process.
Yeah, no doubt about that. Jim Watkins is our guest here today in our medical program, brought to you by the Medical Specialty Clinics of the Bryan Hospital and the community health professionals. We step away again to pay some bills and also for some ONN news. When we come back, there's some other things I need to hear from our Williams County Commissioner today. Maybe where we stand with some of the health issues that are going around the country. And also, I'm curious as to where maybe this government shutdown leaves us with some of the programs that might affect us here in Williams County. Jim Watkins, our guest here on our Medical Hour on a Wednesday on theCUBE.